When we're talking about the heart, the cardiac cycle is just one complete heartbeat. We know that both sides of the heart, the atrium and the ventricle, are going to beat. Now, when there is a contraction of one of the heart chambers, it's called a systole, and the relaxation of that chamber is called the diastole. So during ventricular systole, the aortic valve is going to open so the blood can pass through, and during diastole, the aortic valve will shut so it will prevent the backflow into the ventricle. The blood pressure reading is pretty much the reading of the force of your blood on your arteries. So during systole, the force in your arteries is very high because of all the pressure. And this is what they take the reading from. So the top number is going to be the systolic, or the reading from the systole, and the bottom number is going to be when the ventricles relax. So that's going to be the lower number. And like I said, the blood pressure is actually just the force of the blood against the wall of those arteries. Sometimes when your arteries start to lose elasticity, they will start to get a little bit more rigid, and that's what's going to cause some high blood pressure. Here are kind of the blood pressure, what they think they're looking for. If it was low, it would be less than 80. Normal would be 120 over 80 or somewhere around there. And then here's when you start to get into hypertension and prehypertension. There are 4 different things that can affect your blood pressure. Obviously, the cardiac output, how much your heart is beating, and the amount of blood that you have, or the volume. Most people, like we said, have about 5 liters of blood. But like for pregnant women, they have more blood, which could possibly increase the amount of their blood pressure. Also, blood viscosity. So we talked about Lance Armstrong and how he was taking that EPO that would increase the amount of red blood cells that he had. Well, this would increase the blood viscosity. So when you do take the EPO, you're at higher risk for like heart attacks and things like that, just because of your blood viscosity. That's going to increase your blood pressure also. And then just the resistance that you have in your peripheral arteries. Now when you hear your heart beating, it's a lub-dub, and what that actually comes from is those valves that are shutting when your heart beats. And usually a resting heart rate should be somewhere between 60 to 100 beats per minute. Like a lot of runners, sometimes it's even lower than that, just because your cardiac output, your heart's very efficient at beating because the muscle is very strong. So when you go to have your heart tested, they would do an EKG or ECG. That's just called the electrocardiogram. So when we talked about in the muscular system, we talked about the depolarization, repolarization during a muscle contraction. So when you're looking at this EKG, this P right there is the depolarization of the atria. So it's the atrial contraction. And this QRS is going to be the ventricle contraction. And then the T is the repolarization of the ventricles. What they're looking for is abnormalities. Tachycardia would be a very fast, you see that very fast rate. Brachycardia is right there in the middle. That indicates a slower heart rate. And then arrhythmia is just the irregular heartbeat, which you can see there. Now the blood vessels, you have arteries and veins, but they also stem into things called, so arteries are the largest ones. They're strong because they have a lot of force from the ventricles, and they carry the blood away from the heart. Arteries are going to pass blood into what are called arterioles. They're smaller. And then finally they go into capillaries, which are the smallest blood vessel, and that's where all the gas exchange is going to take place. After the gas exchange takes place, then that blood is going to start to move into what are called venules. They're smaller than veins. And then it goes into the veins. Now veins are thinner And they're going to need the help of muscles and different things to move the blood back to the heart. These also, since they're not under high pressure, they have valves to prevent backflow in them. So here's another picture of the capillaries. This right here is where the gas exchange is going to take place, and that's because they're very thin. They're just made of that simple squamous that we talked about. So that it can allow the oxygen to get into muscles and organs and brings the carbon dioxide out. Now you do have what are called pre-capillary sphincters. They're going to allow more or less blood flow. The reason this is, so maybe if you're going out to work out, it's going to direct all of the blood flow to the muscles, your leg muscles especially, and then it's going to not get as much. So that's why they always say that you want to work out before you eat, because if you eat and then go work out, you are cutting off some of the blood flow for that digestion, and digestion's not taking place well enough because it's sending more blood to the actual muscles. And here's a picture of those pre-capillary sphincters that right before the capillaries, they would shut some of those off, and either it would cause them to constrict, or if you need more, it would cause them to dilate. So in the veins, it's not very efficient because it doesn't have that muscle like the heart behind it to return to the heart. So what's going to help that is contraction of your diaphragm located right below your lungs or your rib cage. Also, your skeletal muscles will help return some of that blood, and those valves in your veins will are produced so to prevent the backwards flow. So like when you go to the doctor, they give you those compression socks, and one of the reasons is if you are sedentary for a long time, a lot of times that blood will pool and it starts to develop clots. So you want to be able to force that blood back through your veins, back to the heart, so nothing is, so it doesn't form a clot. Varicose veins are when that blood starts to pool in those veins because of possibly a valve or malfunction. So when we look at we've already talked about the major blood vessels. The aorta comes from the ventricle, the left ventricle. Then you have your pulmonary trunk and pulmonary veins that are heading into the lungs. And then you have your superior and inferior vena cava. So we will be dissecting on Thursday for people in class. In virtual, there's a virtual dissection for you. But here is the actual heart that you need to be familiar with, and the blood flow. The blood flow is going to be just like the box heart that we did, but it's obviously just a different shape.